Welcome to the Renegade Health Boss podcast, where we push the boundaries of what's possible in health and wellness. I'm your host, Heather Gray, a certified functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And each week we dive deep into the world of physical, mental, spiritual health, biohacking, relationships. But we're not just talking about the basics. I'm bringing you conversations with the true renegades, experts who are challenging the status quo in their fields, breaking barriers, and uncovering the real truth behind what it takes to live an incredible, joy-filled, and optimized life. If you're ready to step out of the ordinary and step into a life of extraordinary health and happiness, you're in the right place. Let's get started on this journey to becoming your own Renegade Health Boss. And before we jump in, let's hear a word from our sponsor. You're already empowering your patients to lead a healthier, more vibrant lives. As a practitioner, you're at the forefront of extending their health span, promoting strength, vitality, and overall wellness. It all begins with the right support, trusted high-quality nutritional supplements. At MHP Vitamins, we provide premium, practitioner-grade supplements designed to support the unique needs of your patients. Whether they're fighting inflammation, boosting energy, or enhancing immune function, our scientifically backed formulas help them thrive. As a trusted practitioner, your recommendations make a significant impact. At MHP Vitamins, we're committed to providing you with the tools to continue supporting your patients on their journey towards ideal health. The premium supplements are carefully formulated to target specific health concerns and deliver the essential nutrients your patients need to thrive. Dedicated to making sure your practice runs effortlessly by offering top-tier customer care, same-day shipping, and the efficacy of our new office and warehouse. Through our affiliate program, you can extend these benefits directly to your patients and provide them with trusted, high-quality products while providing a valuable partnership that supports both you and your patient's health span and your practice. Join the growing community of health professionals who trust MHP Vitamins to empower their patients' health journeys. Together, we can support wellness, one patient at a time. Yay! Wow! Welcome, Dr. Sharla, to the show.
Hi.
So awesome to have you here. You're only the second person ever in over 100 episodes to be talking about dentistry stuff. And I swear I need to have you on like 6 more times because like this is the foundation for so many health things. It's not even funny and it's not even close to being covered enough. So I want to say thank you so much for taking the time out of your busy practice to join us today.
Oh, thanks for having me. I can't wait to chat with you more about it.
And pronounce your last name for me because I'm a goober.
Oh, Aronson.
Aronson, that's right. Aronson, son of Aaron. That makes sense. I don't know why I look at it and my brain just gets a little twisted. So whatever.
It
Aronson.
happens.
Okay. Fabulous. All right. Tell us a little bit about yourself. Like what made you want to get into dentistry to begin with? And then how did you go into the functional biological dentistry?
Yeah. Well, that's funny you asked that because I was one of those people that knew from the time I was a kid I wanted to be a dentist.
Shut up. Was it because of Rudolph the Red-Nosed Reindeer? Did you want to be like Hermie? Did you want to be a
No.
dentist?
I actually had trauma when I was 6. I got hit in the mouth with a baseball bat. And instead of it scaring me, I was like, wow, that was so cool. My dentist helped me and I got really into it. I know, started working in a dental office in high school and then, went from there. So I thought I did dental school, got married, had kids, thought I had the dream. But as probably most people, there's something that changes everything. Something usually turns people into holistic health.
That pain to purpose story.
Yep. For me, my first child was born with hearing loss, which was shocking. We have no known history anywhere. And I think it just opened my eyes to the fact that health is not a given, that who knows why it happened. This was in the same time period that I learned about epigenetics. And while I still don't have any answer at this point, I also know that epigenetics is out there. Things turn our genes on and off. I don't know what maybe possibly turned on the gene for her, but it really made me reconsider how I approach health personally. And that led me into discovering biologic dentistry, right? Which is not a specialty of dentistry, it's a philosophy. It's the fact that the dentist realizes that what I do in your mouth affects your body, and your body's health, your body's inflammation, all of that affects the mouth.
I remember when we first met on our coffee date and we were just like geeking out over each other because like I said, I just love what you folks do so much. Because it was a huge part of my story, right? Like uh every single client I work with, I have them rule out 3 things before we even start chasing Lyme. And one of them is cavitations, the other one is sleep apnea, the other one's mold, because the 3 of them are such barriers to health that it's and a lot of people aren't talking about it. But I remember we were sitting there talking at the coffee and you were telling me about like high percentages of miscarriages and other things that go on in your field that a lot of people aren't talking about because of the toxicity of your field. Could you kind of go into that a little bit more?
Yeah. So my first dive into biologic dentistry was learning about mercury. So believe it or not, those quote unquote silver fillings in mouths are 50% mercury. And they say that once it is amalgamated or mixed with other metals, you're not exposed to it. However, the International Academy of Oral Medicine and Toxicology has great research that shows that it does, in fact, still expose you to mercury whenever there's friction or heat, which is every time you eat and chew and speak and grind your teeth.
Or
But
eat
on
or
top of
drink hot coffee. That's this sign here is danger coffee. Hot coffee,
yes,
what I've been told, hot beverages have been known to make that leach too.
yep, it makes it all leach out. On top of that, it's like, well, we know there's high exposure when we place them, when we remove them. And oh my gosh, I place and I don't place it actually. I never placed it, but I remove it all the time with zero protection. And that research is really scary. Again, the IAOMT has it, but it shows that women in dental fields have higher levels of miscarriage, higher preeclampsia, like all the pregnancy outcomes are not as great. Um, and you know it really is impactful. It's sad that unfortunately most dentists don't know it, but once you kind of find out, you can't go back, for
Right.
me at least.
Once you take the blue pill, is it the blue pill or the green pill? I can't remember. But once you take them, you can't go back. But you know, and I a lot of times people want to make doctors out to be kind of villains, and the same thing with like traditional dentistry. And I don't think they're necessarily villains as much as they are ignorant, right? I mean, wouldn't you
Sure.
kind of agree is that you guys are taught a certain way? It's always been that way. You know, it takes a long time for things to change. So can you talk about some of the differences and ignorances the differences between like biological dentistry and traditional dentistry? What are some of those philosophical differences?
Sure. Yeah, I absolutely agree with you. I think a lot of times it's people just don't know. They think, well, I was told in dental school it was safe. I was told in dental school that fluoride is the way to go, right? Fluoride, if you look at the research, is a neurotoxin. It doesn't help when it's in our water. It only helps during development of teeth. Um, it's best used topically, and we have other options. So that's one thing you're going to see right away. The other thing is the way that a biologic dentist is going to approach something like an infection is different. I have conventional colleagues that will see an infection and say, no, it's fine. It's not symptomatic. It's an infection in the bone that is leaching toxins from those pathogens. It may be storing something like Lyme, mold, that kind of thing. And it's causing massive inflammation throughout the body. Even like certain cytokines, there's one called Rontis that there's research on right now that they're linking to cancers and stuff. So it's not harmless. That's something that, you know, biologic dentists are not going to be like, oh, it's fine. It's just a little infection as long as it doesn't bother you, you know. The other thing, the other thing is we're really cognizant of what we're placing in the mouth and the biocompatibility of it. So, you know, obviously trying to pick the least invasive, the friendliest to your body with all the materials that we're using.
That's crazy. I've heard some horror stories of the wrong type of like metals and things being placed and causing headaches and causing like electrical jolts and like, I mean, who would have thought that you need to, find out the type of material that you're putting in somebody's body needs to be compatible. Like some of this stuff just seems so common sense to me since I'm kind of on the other side of it. Like how on earth did this stuff get missed for so long is just completely beyond me. How much longer schooling is it to do, the biological dentist route?
Because it's not a specialty, there's no
Okay.
specific schooling. So
Okay.
biologic dentists are going to be self-educated.
Oh,
Um, so therefore, I think as a patient, it's hard to know, like, how do you know what biologic dentist to go to? The IAOMT is doing a really good job trying to make sure that the education is more standardized within biologic dentistry. So they have different tiers of members. They might have a member, which maybe they've been to a meeting. Then you have people who are SMART certified. So those are people who are certified to safely remove amalgam, mercury amalgam fillings. Then you have people who are certified through them. And that is like a 16-hour course. You have to read all the research and do presentations in front of their board. So when you find someone with that, you're going to have, or it's not certification, it's accreditation. You're going to have somebody who really knows what they're doing. They're not just kind of maybe dipping their toe in it to get more patients. They're actually fully in it.
that totally makes sense. I had no idea it wasn't an actual, like, functional medicine. You can go back to school and you can get your degree in functional medicine. Like I thought that that's what that was. And I was shocked one time I had sent somebody to a biological dentist out of state and they weren't using like a dental dam and like some of this other protective type stuff when they were taking out their mercury. And I thought my head was going to explode. I'm like, wait, you went to a biological dentist though, right? And they're like, yeah. I'm like, this doesn't add up, but okay. Now I know.
Yeah, that's what it is. There's not like a standard.
Oh,
So you would want to look for things, right? Like look for a SMART certification or look to make sure that they're doing the steps like the rubber dam. Um, Look to see how long they've been doing it. That all plays into it. And also, the experience is very different. So we're looking at root cause of things. So you wouldn't come in and we're not just looking for cavities and telling you you need fillings. We would look at, oh, you have cavities. What is your pH? We're thinking about gut health. What's happening with the airway? What's going on with the microbiome? So our new patient exam is a 2-hour appointment followed by a 1-hour consult. It is not your typical dentist pops in for 10 minutes because we're trying to get to the root cause. And that takes, more time, more tools. We're always using a CBCT, which is a 3D X-ray, looking for things like those hidden infections.
it never ceases to amaze me how even like it was probably a year ago I went to see a traditional dentist for just a regular cleaning. I don't know what the hell I was thinking. I know better. I know better. They found a couple more cavities and I'm like, this is not possible. Like you don't understand. And they're still really kind of drilled on, your diet and sugar. And
Mm-hmm.
really they're starting to find out how much more mouth breathing, right, contributes to cavities. And once I figured that out, thank God, and started taping my mouth at night, wow, I go back to the dentist and I have no more cavities. Like that's the part that I love different about a lot of biological dentists is because I'm a why type of person, right? Don't just tell
Yes.
me I have a problem. I'm like, no, why?
Yes, exactly. Why and what can we do to prevent it?
Yes, right? But they
Let's
don't
get
want
out of this
prevention because
cycle.
then that takes them, that takes away their paycheck, but it didn't make any sense to someone who had such a clean diet like myself. Like I'm, my clean water, I got the fluoride out, I'm doing all the things. And every single time I go back in a new cavity, I'm like, you have got to be shitting me.
Mm-hmm.
And nobody had answers till I saw a biological dentist.
Yeah, exactly.
Awesome. Well, this is a really great place. We're gonna take a quick pause. When we come back, we're gonna dive deeper into cavitations, what they are, what they're looking for, what they can cause, and just the connections that they have to a lot of inflammation and health issues. I know, like I said, it was a huge part to my healing story. So don't go anywhere. Stay tuned. We'll be right back.
When you're facing painful symptoms, a diagnosis of chronic Lyme, or an autoimmune disease, it can be overwhelming to navigate. You already know mainstream medicine doesn't have the tools to support you, and often even alternative medicine can become a maze of options without sustained results. Modern living puts significant stress on our systems. To counter this, we need a holistic approach, utilizing the latest technology and guided by physicians with decades of clinical experience. This is biological medicine. The Biomed Center in Scottsdale, Arizona is one of the most comprehensive clinics in the world, incorporating the latest diagnostics available, such as full-body MRIs, computer regulation thermography, heart rate variability, toxin screenings, and along with hormone and gut testing, they achieve the broadest look at all systems of the body. Customized protocols are developed by physicians who have treated thousands of patients in chronic disease by optimizing their biological performance. Save yourself years of suffering and searching with a visit to the Biomed Center, Scottsdale. The future of medicine is here.
Yay, welcome back. I just love this subject so much. I don't know why. I think I do know why, because it was right around 2020 when I had heard from a dentist 2 years prior. I had this big bony protrusion up here. It's insane. I didn't even know it was there till he pointed it out. And he's like, I think you have a cavitation. And I was like, what? And, I just kind of dismissed it, whatever, for about 2 years. And then I had a physical therapist who was doing some kind of energy work with me. I didn't even tell her I had cavitations. And she stopped and she goes, you keep chasing Lyme, but until you get this infection in your jaw cleaned up, you're not going to get anywhere with it. And I was like, I'm sorry, what? And then my next step was to see a biological dentist. They did the x-rays. Turns out I had cavitations. Like, cognitively, I was losing my shit. Like, everything, my brain was shutting off. I would walk into a room, forgot why I was walking into that room. At a stop sign, forgot where I was going in my car. I developed a stutter. Like, cognitively, it was insane. But I had had this infection in my body since I was 15 years old. So 15 to 42, right? Do the math. This low-grade infection in my jaw. And it was amazing. After I had the surgery, 2 weeks later, it was like everything started coming back online. I mean, it was a night and day miracle. And I think I'm starting to get all choked up. I know that's why I love this topic so much, is because, again, hardly anybody is talking about it, and it's so ridiculously important. So let's dive deeper into cavitations. What are they? What causes them? What kind of signs and symptoms are you looking for, and what can you do about it?
Yeah, those are great questions. So a cavitation is an area where there was an extraction or an infection that didn't heal in the bone. So the most common sites that we see them are in wisdom tooth sites. And that's because when you take out a tooth conventionally, you take the tooth out, the doctor just takes it out. Maybe they stitch it up, but usually they just leave the wound open, and you have oral bacteria that get down in there, and things don't always heal. In addition, around a tooth, there's a little ligament, and they don't take that out. And so that ligament can be trapped in the bone. And therefore, when only way we see this is on a 3D X-ray or a CBCT, but we'll see a dark area of the bone that is trapped. So that's what a cavitation is. We'll also see it sometimes in sites where maybe there was a root canal infection, tooth was removed, but not all the infection was removed. And if you go to just an oral surgeon, a conventional oral surgeon, and ask them about cavitations, they're going to tell you they don't exist. It's not accepted in all of dentistry. You cannot find it without a CT. And the question mark, it's actually my holistic colleagues. It's the functional medicine doctors that are pushing us biologic dentists and educating us that this is problematic. The amount of inflammation and toxin that comes from this and the effect on the body is huge, especially with people like Lyme. The Lyme doctors are always the ones sending them to us because, and now maybe you help me, but my understanding is if you have cavitations and you're doing all this work to clear Lyme, the Lyme's like, cool, I'm going to go hide in this cavitation where the blood flow can't clean me out and nothing gets to me. And then when you stop and you let up, it just comes back.
That, and I was told that it keeps your troops too scattered. Your immune system is really working hard to get, because if you think about it, right, this infection in your jaw is so close to your brain. It's really trying to protect your brain. And so your troops are scattered. It's like dealing with this low level of infection all the time, that there's nothing left over for anything else. And so, yeah, right. I think both have a good play of why Lyme is so hard to treat, especially when you have a cavitation. So, yeah.
Yeah.
Yeah, it's funny because I even had dry sockets. So I had my wisdom teeth. Yeah, right. Fucking oh, I'm all fired up, pissed off. I wish I could remember who this dentist was, back when I was 13, because I'd really love to knock back on their door and go, dude. And again, ignorance. I get it was ignorance. It was nothing malice.
Right.
Although he was kind of an ass because when he was taking it out and I was coming out of anesthesia, I came out of anesthesia too fast and it was starting to hurt and I was starting to cry. And he's like, "Oh, are you gonna water my garden for me?" Yeah, no, trust me.
Oh,
Yeah,
that
trust me,
is,
it was traumatic. But uh crap, where's I going with this? I'll keep going. But the infection and
um,
cavitations.
yeah, exactly. So, it's like you said, troops and
Yeah.
hiding. As far as symptoms, people don't always have symptoms. It's pretty rare, actually, that people have symptoms other than systemic things. We might see things like elevated CRP, that people are like, we've ruled out everything else. My dentist or my doctor said I need to come check with the dentist to see if there's some sort of tooth infection because it's a chronic low grade infection. Your immune system is keeping it at bay. You don't have swelling or draining or pain necessarily, but that doesn't mean that it's not problematic.
Or unless you get these crazy bone things like up here. So that's not problematic, but it was a symptom. It was a sign that I had an infection because my body was trying to encapsulate it in bone. But that's what I was talking
Yeah.
about was the dry sockets, right? So I get
Yes.
dry sockets 2 days later. So that's a telltale sign for an infection.
Right.
Again, they didn't stitch it up. All I did was put this clove flavored gauze stuff in there that was horrific. I still to this day can't handle the taste of clove. But yeah, so many things went wrong with that. It just makes me laugh that of course I got cavitations.
Right. And like you said, he probably didn't know better. The
Right.
standard of care is to take the tooth out and that's it.
And leave the
Um,
ligament. See, that's the part that I always
mhm.
forgot. I would try to explain it to people and I'm like, I don't remember. They leave something behind. It's a ligament.
Yes. And I would say, so how do we prevent them, right? Like, say you have to get a tooth out. How would it be different in a biologic office? So, tooth is going to come out. We're going to remove the ligament. The ligament has bacteria all over it. So, the ligament's going to come out. Any infection that we can get to will come out. Sometimes I spend 15 minutes getting a tooth out and 30 minutes getting all the infection out. Then we're going to use something like ozone, which is like a super oxygen to get the bone disinfected. We're going to use a laser to, again, disinfect the bone. And then we actually use something called PRF, similar to PRP, platelet rich fibrin. We take a couple of vials of the person's blood, spin it down, create an actual clot, and put that in the socket. That's going to prevent dry socket. It's going to immediately protect the bone, and it's putting all those cells in there that are going to rebuild, regenerate the bone. So that's how we prevent it. Just having them pulled out and leaving it open can set you up for, potentially getting a cavitation.
It was horrible when I had mine taken out, the cavitations cleaned up, and they sent it to pathology. The crap that they found that were in there, it was absolutely disgusting. The viruses, the bacteria, a couple of the bacteria, one of them in particular is common in people, has people miscarry, which I did miscarry, right? So, and part of my jaw was like the inside is almost hollow because of how much of the infection kind of chewed it out. Like it was insane what they found in there, after 20 some years of this low grade, infection and, hey guys, party on, everybody
Mm-hmm.
was invited to the party and it did, it showed up in me cognitively ruling everything else out, but I'm literally losing my brain, in front of me. It was scary. It was like having Alzheimer's, at the
Yeah.
age of 40 something. I mean, the decline was just insane. And then the chronic, inflammation. So it was a lot of chronic pain and stuff that went along with it too. And it's so sad because Lyme folks, when they get that diagnosis, Lyme turns into the big bad monster and it becomes the boogeyman for everything. And I tried
Mm-hmm.
telling them like, no, there's usually other things. It's not all Lyme typically, right? Like let's dig deeper.
Yeah, it's usually a co-infection or there's something else, right? Making you susceptible. And yeah.
So what So no symptoms, very, very rarely. How long does it typically take somebody to kind of recover? And what does that procedure look like? So you say that you use, a person's own blood, you make a clot. How long and what does recovery look like?
So, as far as treating a cavitation, there's two ways to do it. One is surgically. That is the most definitive way. So that would be you go back into the site. It's pretty wild when you actually access it. It we'll often find gunk, right? Like you can biopsy what's in there. It's um, even like an oily cyst, and it's supposed to be bone. Or you'll find yellow, white, creamy stuff, granulation tissue, which is your body trying to encapsulate. Um, so that gets cleaned out, laser, ozone, PRF, close it back up. Um, that's how you handle it surgically. It takes your body 6 to 12 months to fully fill that bone back in. The other way that it can be treated less invasively is with ozone. Ozone is going to rely on the body's system to do the cleanup. So we have to have a well-functioning immune system in order to be able to do that. With ozone, we would use a port that goes into the bone, and then we can flush with ozone repeatedly. So ozone, it's not a one-time and done. There you're treating a biofilm and allowing the immune system to, heal. So it's 5 weeks in a row that you have to treat with the ozone.
Okay. Talk to us a little bit more about ozone because so many people are still freaking scared shitless of ozone. And I mean, I have a machine that I use at home that I've put it in every single orifice of my body, and I'm a huge fan of ozone and I love that biological dentists are using ozone more than like I think any other practitioner out there. So tell
Yeah.
us why ozone?
Yeah. So ozone is a super oxygen, is what I think of. It is not what you think of when you hear ozone warning day. An ozone warning day is dirty ozone, which means ozone is mixing with pollution and making nasty chemical or nasty VOCs. Ozone that I'm talking about is medical grade oxygen turning into O3. That is, it breaks down really, really fast and it kills things that die in the presence of oxygen, which is most of our pathogens. Additionally, it causes the body to make peroxides and it sparks the immune system to attack whatever's going on. So we use it in dentistry for like periodontal disease, which I know people don't think it's a big deal, but periodontal disease is a disease. It's a low-grade chronic infection. It's a problem. It's caused by anaerobes. We can use that gas, put it in the pockets that people have to kill those bacteria. We also use it like on teeth, in sockets. We can inject ozone. We can use it through sinuses. So like say somebody has an infected upper tooth, we can use ozone therapy through the sinus to get to the tip of the root, maybe after you're extracting the tooth. Can be used in the ears for TMJ issues. It's amazing. And it doesn't have any toxic side effects, right? Like it's oxygen and peroxides.
So it's funny. I love how we both actually have two parts to the same story. I didn't know that about the VOCs, but the way I was explaining it to people, and they're like, "But it's a high ozone day," and I'm like, "Ozone's not the problem. Pollution is the problem, and ozone is there to clean it up." So the reason that it's high in ozone that day is because it's there to clean up the pollution. The ozone's not the bad guy. They
Right.
buried the lead with that one. They really got it ass backwards. But yeah, I absolutely adore ozone, and I've got it. Well, I ended up winning a door prize from you guys, the little ozone
Yeah.
that I use to clean my produce. I'll put it in a room for an hour and shut the door and clean the air. Like I love ozone. I love the smell of it now.
Yeah. It grows on you.
It does. It's like the smell of clean.
Yeah. Yeah.
Right?
And, you can't breathe it. So I think that's the other reason people get nervous.
Right.
They think, oh, is it like poisoning you? It's not. It's that our lungs and our eyes are the only tissue in humans that don't have an antioxidant layer. So ozone is an oxidant, which is what it's doing to kill these things. All the rest of our cells are protected by antioxidants. So as long as you're not going too crazy with it or cranking it up too high, it's fine. It will kill the bad guys and not harm your good cells.
Absolutely. Ooh, love it.
Yeah.
Didn't realize we get to talk about ozone. I love it. So I would love to hear, so you said, periodontal disease, people think that it's not a big deal, but it is, it's a disease. So tell us a little bit more about the connection to oral health and overall physical health.
Right. So this is what always blows my mind. The connection between gum disease, periodontal disease, and overall health is well established. Any of your dentists should know this. It's linked to Alzheimer's disease, cardiovascular disease, diabetes, low term, what do they call it? Low term birth weight. I don't, pregnancy
Oh,
complications,
gotcha.
right? Low weight babies, all of that's in the research. Even, and then like when you look at the bacteria involved in periodontal disease, there's linkages to all kinds of cancers.
Mm.
So yeah, it's a chronic condition. It can go elsewhere in the body. We know that it can go, they'll find bacteria from periodontal disease or root canals in heart plaques.
I
It
was
doesn't
watching
stay
a
in your
dude
mouth.
talk the other day and he had like visible rotting teeth in his mouth. And I'm like, oh my God. Like he was also morbidly obese and smoking cigarettes. So, his teeth might be the least of his problem, or the beginning of a lot of it, but it's just it's just bizarre. It's just bizarre to me how people don't take that seriously, right?
Right.
It's just, they think it's aesthetic, but it's not.
No. And I think people forget too, it's actually a view. It's sort of a visual of like your overall oral health.
Mm.
If you have gingivitis, which is swelling of your gums, yes, your dentist might say you're not flossing enough, you're not brushing enough, but it could be systemic
Right.
inflammation, and as you mentioned, like you felt frustrated because all they want to talk about is your diet. It's sugar and it's you're not brushing your teeth. That's not all that causes dental disease at all.
Not drinking enough fluoridated water. That's what it is.
Right. Right.
No. So what are some, because we're kind of getting close to the end here, what are some of the like main hacks that you would love to see everybody start doing to kind of help improve their oral health?
Good question. So you mentioned one of them. One of our favorite tips is lip taping.
Mm.
Lip taping is impactful because if we can make sure we're nasal breathing, that's going to help balance the oral microbiome and decrease your risk of cavities and gum disease. I would also say switching from a fluoride toothpaste to a hydroxyapatite. Hydroxyapatite sounds like a crazy chemical, but it's the mineral that makes up most of your tooth. And there's a lot of options now for that. So why wouldn't you use it? It will also prevent cavities. It helps your tooth repair itself if you start getting a cavity or something. And then just don't ignore it. People think if it doesn't hurt, then it's fine, which is not true. Especially a tooth that's had a root canal is not going to give you symptoms. That doesn't mean it's okay. You need to make sure that you're checking, at least I would say every 5 years, make sure that you don't have a hidden infection going on. Yeah.
So you touched on real quick, root canals. Biological dentist, Weston A. Price, especially, it was like nobody should be having, root canals. Why is that? And what could you do instead? Or can you still do them? It's just a biological way that's different that doesn't cause the infection.
I think you could ask all biologic dentists and you might get different opinions on this.
Right.
So I'll give you mine. What we know about root canals is even the best done root canal, the best techniques, laser, ozone, everything, there will still be some bacteria in that tooth once it's done. And that's well established in the research. The question is that problematic for a patient and their immune system? I think it depends on the patient, right? So if we have an intact immune system, no chronic health conditions, that person might be okay. Mm. When we have people who, as we were talking about, we don't want our troops distributed everywhere. Do we want them constantly having to keep this, in check? Maybe not. The hard part, the dentist part of me, because I am still trained as a dentist, you come to me with like a broken off tooth and you want to save your front tooth, we may need a root canal. Or the most common reason that we would do it is like when people have trauma. So a 16-year-old gets trauma to their front teeth, and if we take their tooth out right now and put in an implant, it's going to be in the wrong position when they're older. So what do we do? If we take it out and we leave it and wait for 10 years, there's never going to be enough bone for an implant. Sometimes there's a place where we may need to preserve the tooth. That's my opinion. And that's just realistically. I mean, I have one of those from this week. This guy's not going to finish growing for 10 years, and 3 of his front teeth are root canal treated. We can't take him out yet, but we can get rid of the infection. So anybody with a root canal, I would recommend making sure they get a CT every 3 to 5 years to make sure there's no infection.
And I need to add this because I heard someone the other day, they got a CT of their head and it looked fine. No, not a CT of your head, darling, a CT of your mouth.
Yes. And yep, you need it of your jaws, and it needs to be able to zoom in so you can see if there's infection going on, and maybe even a tooth fracture.
I was shocked when I sent someone to a dentist to have that done out of state, and that's what they came back with. I thought my head was going to explode. I'm like, who am I working with here? Like, it's amateur season. So yes, I just needed to put that disclaimer in because I was shocked when they came, when I was like, you need to go get a CT scan, and they came back with a head CT scan. And I went, what am I supposed to do with this?
Yeah. So yeah, you have to have that. The other thing is, like, prevention is huge. So don't wait till it hurts. If you wait till your tooth is killing you, that means the nerve is already dead or inflamed to the point of dying. And it doesn't matter how much laser and ozone I do. We're still going to be having the conversation of, do you want to do a root canal or do we want to extract the tooth? So prevention is super important. Sometimes people come to biologic dentists and they think, oh, you're not going to do any fillings, right? We're just going to watch things, or we're going to repair things. There's still a point at which I have to intervene soon enough so that I don't end up, we don't want your tooth to be like half missing by the time we fix it, or you're going to need a root canal. So that's kind of a common thing that I'll run into, is people are like, well, you want to be conservative. Yeah. But sometimes conservative means we have to act a little bit sooner so things don't get deep.
So with those people, those younger people who are getting the root canals, which totally makes sense. The way you explained that was just beautiful. Would you suggest maybe having them come in once or twice a year? I mean, every other year, to get like ozone injection type of things to kind of keep infection down?
Yes.
Would that be a preventative?
Yep. So we can do like ozone injection around the tooth periodically, do it at the time of their cleaning. And then of course, monitoring with CT. In this case, we're just trying to buy 10 years, and they know it. And they're like, yep, we're on board. Let's buy 10 years. And then we're going to take the teeth out and do implants once he's done growing.
Okay. Totally makes sense. Never even thought about how much your face and your mouth changes when you're growing up. That totally makes sense. Because God, could you imagine to have to take an implant out and then have to, can you even re-put it, or is that just,
you can, but you take them out, we're compromising bone. It's tough, especially in the front. Like, aesthetically, it's a big deal. People think, it's just a tooth. Well, it's a miracle creation, actually. So to be able to replace it and have it look beautiful does take, a lot of skill, and we need bone. And
it's not even just the tooth. There's a lot of, we didn't even touch on, and we're running out of time, is, how each tooth is related to a meridian and an organ systems in our body. So it's not just a tooth. It's a tooth that's connected to us somewhere else, right?
Exactly. And that, when you were talking about metals, that's one of the things too, is, each tooth is on an energetic meridian, which, it's funny how people will say like, oh, that's quack. If a dentist is talking about meridians, they're quacky. Meridians are well established as well. If you've ever done acupuncture, they're using meridians. They exist. Teeth sit on them. Dead teeth, cavitations, and metals block the meridians. They're going to block the flow of energy. So even though I'm talking about implants, most people think titanium. Most biologic dentists are going to be using zirconia, because that does not block the meridian, and it's nice and biologically compatible.
Ooh, I didn't know about that. Okay. Because I always wondered about the titanium. And so you're right. Okay. But I didn't know that there was an alternative. So that's good to know. I had one, another molar pulled out a couple years ago, and I still kind of go back and forth on whether I want to get an implant with it or not. But anywho, that's beside the point. Yeah. My whole experience into my dental, it's just every little layer I've had to pull back from my own health journey. I swear I could like write a book on because there's just not a whole lot of people talking about the right way and the wrong way to do a lot of these things and the prevention of it. And that's really what's needed out there. So again, I just can't say thank you enough. So how do people find out more about you? Where are you located? How do they work with you?
Yeah. So you can find us online or on Instagram, Facebook. We're Alive Dental. It's myself and then another doctor, Dr. Ahmed, has joined my practice, and he's great. Um, the other place, and we're in Colorado, actually. I'm lucky to be close to you. So we're in Fort Collins, Colorado. We serve people from all over: Wyoming, Nebraska, Utah. They come from all over. And happy to do that for them. But if people are further or want to stay closer to home, I would look at the IAOMT that I know I keep mentioning that. But they have a resource as well. So they've got a listing of biologic dentists. And as I mentioned, they're going to notate if they're SMART certified, if they're accredited. They're going to tell you a little bit more about, is this someone who's just dipping their toe in, or are they really committed to doing this?
IAOMT. That was worth its weight in gold, people. Mic drop right there. Thank you so much for that. Again, thank you for everything that you're doing and taking that extra step and, getting to the root cause, of, a lot of dental issues and helping people get better. Like what you do is absolutely a God sent. And I just can't thank you enough. So everybody else, make sure that if you heard one little thing that you learned today, make sure to share, like, and subscribe, because that's how we touch other people who are dealing with a lot of these mystery illnesses, and they keep getting told that their labs look normal when they feel anything but normal, or that it's all in their head. It's not in their head. There's something really going on down there. And when we start listening to our bodies, right, instead of covering up symptoms, getting to the root cause of things, it's amazing what can happen. So God bless you all. Thank you. Stay tuned and have a healthy day. If you learned anything, even one little nugget in any episode, please do not keep us a secret. Like, share, subscribe, and leave a review on Apple, on Spotify. That is how we get this information out there, and we change this paradigm one person at a time. I can't do it by myself. I need your help. Also, make sure to know that disclaimer, anything that you hear on this, you cannot hold Discovering Health LLC, Renegade Health Boss, The Line Boss, Heather Gray, liable for anything. Always consult your doctor before doing anything new. Do not take this as medical advice. This is your disclaimer. And then also, if you want to know the foundations of health, right? All that I talk about on how I get healthy, the absolute foundations: sleep, diet, exercise, what to eat, toxins, how to detox mold, all of it. You can get it in your own course at rhbcourses.com, right? Start your healing journey today, as little as $79. Start today, rhbcourses.com. Stay tuned, and thanks for joining us.